My name is Dr. Pathrose Parathuvayalil. I am hailing from a traditional Ayurvedic family. The family's name is Parathuvayalil family. My father and my grandfather and my great-grandfather, others were traditional Ayurvedic Vaidyas, and they were very famous at their times, and they are very specialists in the treatment of fractures, dislocations, sprains, and so many type of trauma cases. That may be the inspiration for me to study Ayurveda. From my younger age, I was with my father, and I was born and brought up by seeing all his treatment and special method of treatment. After completing my matriculation, I went for BAMS. I have studied at Ayurveda College, Trivandrum, and after completion of my degree course, I joined for PG course, MD in Ayurveda. I have completed my BAMS course in 1971 with the first rank, and I have joined for PG course in the next year. During my PG course at the Government Ayurveda College, Trivandrum, I have treated so many paraplegia cases. My subject was Marmabhigada cases. The name of that subject was Kugundara Marma Abhigada. That is a trauma on the back area which results total paraplegia below hip level, and there would be no control for urine and motion. That is the condition of that paraplegia cases, and that was my special subject during my PG course. During that period, I have treated such type of cases at Trivandrum Ayurveda College, and I have done so many research work during that time, and I have introduced the whole body massage treatment at the Ayurveda College. Up to that time, there was no such style at Trivandrum Ayurveda College. I have practiced whole body massage. I was the first man who practiced whole body massage at the Government Ayurveda College, Trivandrum, during my studying period for PG. After that, I joined with my father in the hospital. I belongs to the first batch of PG course. There was so many opportunities to join in the government service, but since father had started this hospital in 1955, and I have to look after the hospital after my father's demise. So I joined my career in the Parathuvayalil Hospital in the year 1975 itself. In my career, I have come across with so many critical cases which was admitted in our hospital. We are dealing with so many back pain cases, with disc prolapse cases, so many neck pain with disc prolapse cases. That cases were treated by neurologists, either by neurologists or by orthopedic surgeons, and since they are not getting any relief, they are coming to Ayurvedic side. Since the patient was not interested in the surgery, they have looked for other options, and that way they came for Ayurvedic treatment. So in that circumstances, I have so many experiences with so many patients with confirmed disc prolapse at the level of lumbar spine and at the level of cervical spine. There was no need of any surgery for 98% of cases. Only 2% cases only needed surgery. All the other 98% cases I was able to cure without doing any surgical intervention. I remember a particular case. I think it was in 1985. That is, after starting my career in the very beginning itself. One patient came to me, to my consulting room, with the help of other person. He was dragging his legs He was not able to walk due to his serious back pain and numbness of both legs, and his both legs were very weak. So he was dragging his both legs. He was a lifetime prisoner at the Pujapura Central Jail, and he came to me during his parole period. Before coming here, he was taken that myelogram. At that time, there was no MRI test. At that time, he took myelogram and done so many modern medicine treatment at Medical College Trivandrum. I was afraid of this patient because he was a convicted patient, and his condition was so severe. Anyway, after a good prayer, I have admitted him. We diagnosed another disease. Apart from his back pain, he got another disease like jaundice. I with a severe pain. I decided to take one Kashayavasti. Kashayavasti is like a enema-like process, which is doing with so many Ayurvedic drugs. After making it decoction, we give that drugs through anus as a enema. So after giving that Vasti, he passed motion. Before giving this Vasti, I think he had 2 or 3 days he was not passing his motion. So after giving that Kashaya Vasti, he passed motion, and the pain also subsided. The next day, when I was in my rounds in the ward, I met this patient in the ward. It was a miracle that he was walking like a normal man. There was no any disability or paralysis of his legs. There was no pain. He was perfectly all right. It was a wonder, and it was a miracle also. That was a wonderful thing in my life, in my professional career. Like that, so many other cases also with cervical spondylosis with severe pain. Severe pain on the neck and radiating pain onto the right hand with muscle wasting. The patient was unable to lie on a table to take even for an MRI. This type of low back pain and cervical pain due to spondylosis, due to disc bulge, we are giving good result. Regarding other field of treatment, we are dealing with so many fracture cases. I remember another case of a type of paraplegia case that is very difficult to walk. Both legs were paralyzed. She was an old sister. She came for Ayurvedic treatment. After completing one course of Ayurvedic treatment for 14 days, she began to walk. We did Ayurvedic treatment like Panchakarma treatment, this Kashayavasti, Snehavasti, Nasyam, and some oral medication. Along with that, we also administered physiotherapy. We have a good physiotherapy department here. Other department like, this surgery department. Surgery department means parasurgical methods, not complete surgery. We treat these piles and fistula with Chara Sutra and some parasurgical methods. And we also treat for infertility for men and women. We also treat obesity cases. We have another department, eye and ENT department. For all these departments, there are separate PG doctors are working here. Our hospital is certified ISO 9000, 2000 certification. For the successful treatment of Ayurveda, we need good medicine. For that, we have constructed a good Ayurvedic manufacturing medicine company. The name of that company is Palm Labs India Healthcare Private Limited. Now we are manufacturing around 50 numbers of our branded medicine and around 300 items of general classical medicine. Now we are in the process of getting NABH accreditation. As a recognition of my service to the humanity through Ayurveda, the government of Kerala has awarded me a Best Doctor Award in the private sector in the year 2012. Before this, I was appointed as a Guru in the Rashtriya Ayurveda department of central government. Apart from back pain, I have already told you that back pain and neck pain due to disc bulge. Apart from that, we are treating with so many orthopedic conditions like frozen shoulder. Frozen shoulder is a condition where the shoulder joints become very stiff and the patient was unable to move his shoulder joints. We are giving very effective treatment for frozen shoulder. Apart from frozen shoulder, this tennis elbow, pain on elbow, and some wrist joint pain like de Quervain diseases, knee joint pain, osteoarthritic cases, and tendinoachilles tendinitis, like pain on this back area of the foot, and the calcaneal pain, pain on the foot. Those patients were very difficult to work, especially early in the morning. Regarding my family, my wife is Dr. K.V. Prasanna. We are blessed with 3 children. My eldest son is Dr. Sunil Paul Pathrose. He is an orthopedic surgeon. And my second daughter, Dr. Sonia Prem, she have completed her BDS and now studying for MDS course. My third daughter, she is BTech MBA. She is now a housewife residing at Mumbai. Dear friends, these are all my good memories of my profession, and I am very happy to share these things to you. I hope you are enjoying these things. Thank you very much for your patient hearing.